Welcome to our second video on death and dying. Generally, in our day-to-day lives, death and dying is not a common topic of conversation. In our fumblings or mumblings, when we do try to talk about death and dying or listen to someone else who wants to talk about it, we may just not be very good at it. Some of you may be good at this, but often we find that we might struggle, that it's not uncommon to feel uncomfortable or to not know what to say. We may say something about there's always death in life. In fact, we have the expression, in the midst of life, we are in death, which comes from the funeral service in the Book of Common Prayer. Now, for myself, each semester, I struggle with this chapter, and for me, it brings some feelings of anxiety as I think about the potential losses that can happen in life. And I'm also reminded of people I've loved who've passed away. However, as difficult as this topic is to think about, there is benefit to having an awareness of important issues related to death and dying. For example, understanding the different types of care, as you'll learn about in this video, can help us as we think about the care a loved one may need, and it can help us to better understand what a friend or family member shares with us as they talk about the care that they're seeking for someone they love. Also, as you'll learn in this video, an understanding of how each of us understands death at different ages. This can be helpful as we think about or talk about death with other people who are at different stages of development, whether it be with a young child, an adolescent, or an older adult. In this video, you're going to learn about where people tend to die and why. You'll also learn about how people at each stage of development understand death, beginning in infancy, then on to toddlerhood, and all the way into late adulthood. You'll also be learning about curative and palliative care and hospice care. And then you'll be learning about the very important role of family caregivers and the effects of caregiving on the caregiver. In the United States, hospitals are the most common places to die. The rates of this are declining, though, due to changes in Medicare policies as people are utilizing hospice. And hospice care can be provided in home, and that's typically where it's provided, but they can also be provided in freestanding or independent facilities that are designed to provide hospice care, or through programs that are based in nursing homes, assisted living centers, or in other types of healthcare systems. The rates of hospital deaths do vary worldwide, and this may reflect cultural views of elder care. At various levels of development, children have a different understanding of the finality of death. For children to understand death, they need to understand some concepts that are related to death, like irreversibility, and this is that death is permanent, it's not reversible. Finality, in other words, that all functioning stops with death. Inevitability, that death is universal for all living things. And then causality, in other words, the causes of death. So at each stage of development, children have different abilities to understand these concepts. For infants and toddlers, they don't understand death, but they can sense what their caregiver's experiencing. An infant's reaction to death is a reaction to the separation that's caused by death, and they may lose weight, they may sleep less and become sluggish and less interactive. For children who are in early childhood, in particular preschoolers, they see death as something that's temporary. And if you think about what you've seen in cartoons about death, you can understand why they may have this misconception. So this misconception of death as being temporary is reinforced by cartoons where characters will pop back to life in moments, maybe after an anvil drops on them from the sky. And since young children are very concrete in their thinking, seeing things exactly as they appear and hearing things literally, it's important that they are told about death in simple and clear language. So when a parent uses a euphemism like she's gone to sleep or traveled to the great beyond or they've passed away, these phrases will not be understood, and they may even generate fears of sleeping or taking long trips. So instead, a young child should be told that their loved one has died and that means that they will no longer be able to see him or her. At various levels of development, children have a different understanding of the finality of death. For children to understand death, they need to understand some concepts that are related to death, like irreversibility. And this is that death is permanent, it's not reversible. Finality, in other words, that all functioning stops with death. Inevitability, that death is universal for all living things. And then causality, in other words, the causes of death. So at each stage of development, children have different abilities to understand these concepts. For infants and toddlers, they don't understand death, but they can sense what their caregiver is experiencing. An infant's reaction to death is a reaction to the separation that's caused by death, and they may lose weight, they may sleep less, and become sluggish and less interactive. For children who are in early childhood, in particular preschoolers, they see death as something that's temporary. And if you think about what you've seen in cartoons about death, you can understand why they may have this misconception. So this misconception of death as being temporary is reinforced by cartoons where characters will pop back to life in moments, maybe after an anvil drops on them from the sky. And since young children are very concrete in their thinking, seeing things exactly as they appear and hearing things literally, it's important that they are told about death in simple and clear language. So when a parent uses a euphemism like she's gone to sleep or traveled to the great beyond or they've passed away, these phrases will not be understood and they may even generate fears of sleeping or taking long trips. So instead, a young child should be told that their loved one has died and that means that they will no longer be able to see him or her. For individuals who are in early adulthood, they tend to experience relatively low rates of death anxiety, and this is because death for themselves seems very remote. In middle adulthood, there tends to be a higher rate of death anxiety, and this is often caused by worries about responsibilities. In late adulthood, individuals at this stage tend to have the lowest rates of death anxiety. This tends to be because they have fewer responsibilities. They've had more time to experience life, and they've also had more experience themselves with death. They're also, at this point, much more concerned with how they will die. Imagine a person receiving treatment for a chronic illness, and their healthcare provider says something like, "It seems to be getting tougher for you to get through your daily activities. Could we talk about palliative care?" How do you think that person might feel? Do you think they might feel alarmed, relieved, maybe confused? Many people have never heard of palliative care, while others may mistake it for hospice. Palliative and hospice, along with curative care, are available at different points in time. And it's important to understand the differences between these three types of care. The purpose of curative care is to cure a disease or to promote recovery from an illness, an injury, or an impairment. It can be provided in a hospital or at home. Services can include physician and nursing care, surgery, medications, and therapies. Two examples could be chemotherapy for cancer and physical therapy after joint replacement surgery. Contrary to myth, starting palliative care does not mean that a person is going to die soon. Many people live for years while they're on palliative care. The purpose of palliative care is to bring comfort and relief from a serious progressive illness that may or may not be life-threatening. It can be provided at home and in long-term care facilities and hospitals. It's available immediately after diagnosis, and it can be given alongside curative care. Services might include physician and nursing care and medications, and non-medical care like care coordination and social work. A personalized care plan might include, for example, pain relief medication, care coordination services, and assistance with preparation of an advance directive form. So who do you think, if you consider what palliative care is, who do you think might benefit from palliative care? Some examples might be a man who's in his 80s who has congestive heart failure. Perhaps he's been hospitalized several times over the past 2 years. Or a woman with chronic kidney disease whose doctor tells her that she still needs dialysis in the near future. Or a cancer patient who's lost their appetite as a side effect of chemotherapy. Or a woman recovering from heart surgery who's not told her family if she'd like to be resuscitated to save her life again. Or a man with dementia whose daughter can no longer leave him home alone safely while she runs errands. Or maybe a woman who's lived with COPD for 5 years and now needs her inhaler to climb stairs and to do laundry. So as you can see, palliative care can be an extremely helpful treatment option for people whose chronic illness has progressed to a point where it's affecting their day-to-day life. The purpose of hospice is to bring comfort and relief to people with a life-limiting illness who've decided to stop curative treatments. It's available only after a person's physician and a hospice doctor certifies that life expectancy is 6 months or less. But of course, people who qualify for hospice can continue to receive services if they live longer than 6 months. Services include medical care, like from skilled nursing and physicians, and also medications, and a wider variety of non-medical care, like social work, spiritual services, medical equipment, alternative support, and grief support. When someone goes into hospice, they have what's called a personalized care plan. And an example of this might be nursing care, pain relief medication, emotional counseling, a hospital bed, a home health aide, and pet therapy. When someone chooses hospice, this is meaning that the person is shifting their priority from extending their life to improving the quality of life that they have left. Hospice doesn't accelerate death, and a person who's in hospice can still see their normal doctors. So like palliative care, hospice care offers symptom relief and assistance with making a person's goals and wishes known. But unlike palliative care, hospice also offers counseling, spiritual support, and grief support for the person's family. All hospice services are covered by Medicare, but there is variation with insurance. I should note, though, that most private insurers do cover hospice care, but not all do, and they each have their own regulations. Cultural differences can affect the feelings that a person has about hospice care. So not everyone who is in a place where they would qualify for hospice care necessarily chooses hospice care. As a matter of fact, many families don't choose hospice until the final days of life. And as you reflect on what hospice provides, you may think that this might be unfortunate because the sooner that a person starts care, the sooner that they can get help in relieving some of their distress and discomfort. Family caregivers serve a very important role in helping people in their family who are older or sick or disabled. It's estimated that approximately 66 million Americans are caregivers, and they're helping family members with chronic illnesses or conditions that prevent them from handling daily activities like bathing, managing medications, or preparing meals on their own. Family caregivers are particularly women, and they're providing a significant amount of caregiving support in the United States. It's been estimated that the economic value of family caregivers' unpaid contributions is at least $375 billion, which is how much it would cost then to replace that care with paid services. So there is a significant economic value that family caregivers are providing. So what precisely are family caregivers doing? I provided you with a few examples, but here are some more. They might do things like helping the family member get dressed, take a shower, and take medicine. They might help with transferring their family member in and out of bed, helping with physical therapy, injections, feeding tubes, or other medical procedures. They might make medical appointments and drive to the doctor or the drugstore. They might talk with the person's doctors, their care managers, and others to understand what needs to be done. They are likely going to be spending time at their own work if they're working, handling a crisis or making plans to help that family member who's sick. And they're often that on-call person in the family too, which means it's not a job that ends at the end of the day like typical jobs do. This is a job that is continuous. It is 24/7. And of course, the degree of demand and the role that the caregiver plays will depend upon a variety of different factors, like the type of illness. So caring for someone with Alzheimer's or other dementias or other brain impairing disorders would be more stressful than, say, caring for someone with a physical impairment. Another example might be that might affect caregiving would be what the setting is. So if you're caring for someone who lives in a rural setting, this is going to cause some unique challenges. And this would include things like having fewer available formal services, like fewer physicians and fewer health education services. There might be transportation difficulties. I think about people who live in Hampton and how this then could cause some or lead to some weather problems in the winter and make it particularly difficult for people who are caregivers, and also geographic distance and isolation. And then also cultural approaches to caregiving can vary from family to family and from individual to individual. In many cultures, there are family expectations about the caregiving roles of adult children, and this is especially true in cultures where daughters or daughters-in-laws are expected to assume the primary caregiver role for aging parents. So now that you hear about all of the different demands that family caregivers might have, and many of you may already know this because you're a caregiver yourself or you have a family member or friend who is, you then can see how caregivers often have to significantly reduce their numbers of hours of working outside the home or leave their jobs completely in order to provide quality care to their loved one. And this means that caregivers are spending hours assisting loved ones in their daily tasks again, cooking meals, taking them to appointments, and doing all the things that I just mentioned. And so this can then lead to some significant financial difficulties. And one study actually showed that people who are caregivers are at an increased risk, in particular if they're women, of experiencing poverty or relying on public assistance. So caregivers are losing a great deal of income when they care for their loved ones, yet they also often have to pay for caregiving expenses out of their own pockets. So some states have programs that allow family caregivers to be paid. So some of these programs are a result of Medicaid. There's one program called Medicaid's Cash and Counseling Program, and there are some other programs like home and community-based services programs that allow people who are caregivers to possibly be paid. And then for some people, if they are a veteran, they may qualify for some benefits that would allow them to have some money to or have some coverage that would pay for family caregivers. Some companies actually offer paid leave for caregivers too. And some long-term care insurance policies provide compensation for caregivers. So these are all important things for each person and family to think about. And I bring this up and spend a bit of time talking about it because so many people are family caregivers, and it can result in a significant financial burden for families. And it's not only that there's a financial burden, there can also be an emotional burden. This can be very taxing and emotionally difficult to care for a loved one who is chronically ill and to provide for them in the way that you as a loved one want to be able to. So what have you learned? You've learned about where people tend to die and why, and how people at each stage of development understand death. You also learned about curative and palliative care and hospice care, and you learned about the important role of family caregivers and the effects of caregiving on the caregiver. What's next? Next, you'll learn about advanced care directives, and you'll learn about cultural differences in end-of-life decisions, patient autonomy, and views on treatment. You'll also learn about active and passive euthanasia and some of the religious differences in practices after death.